Hello, everyone. I am Dr. Doug Wood, a member of the Liturgy Commission at St. Pius X. Some of you may recognize me as a lector, a Eucharistic minister, or hospitality minister at St. Pius. But in my day job, I'm a cardiologist at the Mayo Clinic. Outside Mayo, I'm the immediate past president of the Minnesota Medical Association, and I've served on many healthcare advisory committees for the state of Minnesota and the federal government. Father Russ has asked me to help he and the staff in understanding the implications of the COVID-19 virus and its infections, especially in terms of how we might prepare for a reopening of the church and the celebration again of public masses. In this circumstance, I have reviewed carefully the medical information that we have available, as well as the directives that we've received from Bishop Quinn, the state of Minnesota, and the CDC. And we've also reviewed documents from other Catholic organizations as we think about how we will come back together as a faith community. Before we begin, there is much for us to learn and to think about the COVID-19 virus. This virus, which is a coronavirus, is a novel virus, meaning that it has infected humans for the first time. This is what makes it so contagious and so potentially dangerous. It is a respiratory virus that is shed from the nasal passages of people that are infected. It enters the lungs through passageways in the eyes, as well as the nose and mouth. Once in the lungs, it can cause significant damage, although it is still true that about 80% of people who are infected with the virus have minimal symptoms and may be cared for easily at home. However, there are people who become seriously ill and require care in a hospital, and if it should occur that you would end up requiring a ventilator, there is a high likelihood that you might not survive the illness. In the state of Minnesota, the population group with the highest rate of infection is actually people aged 30 to 39, but it is true also that most deaths occur in people who are over 70. When we think about this virus, one of the most dangerous and difficult parts of planning for how to live with this virus is that a large number of people who are infected have no symptoms. In a recent report published in the New England Journal of Medicine, for people testing positive for COVID-19 in the state of Washington, one of the early hotspots, 56% of those people had no symptoms, and although many of them ultimately developed symptoms, many of those people had no fever, one of the hallmarks that we have classically thought important in this illness. Scientists also discovered in this research report that in the first 5 days of the infection, when people were asymptomatic, they were shedding large amounts of virus. We currently have no vaccine to protect us from this virus. And this means that as we begin to think about the next several months, we have to think about how we can coexist with this virus and protect ourselves from infection at the same time. These reports also mean that we have to approach planning for resumption of public masses with the idea that there will be people walking among us who are infected and yet asymptomatic. Viruses can be sometimes managed with vaccines, and although scientists around the world are working as hard and as fast as they can to find a vaccine for this virus, even under the most optimistic of scenarios, it is not likely that we will have enough vaccine to vaccinate large numbers of people for at least several months, perhaps until the first of 2021 or later. And that means, as I mentioned earlier, that we have to find ways that we can coexist with this virus. To protect ourselves, we have to be careful about congregating in large groups, especially indoors. We have to practice physical distancing. We have to wear masks. Universal masking can reduce the likelihood of transmission by 90%. We must be careful about touching our eyes, our nose, and our mouth, and we should frequently wash our hands. All of these are going to be important considerations for us as we are planning for the resumption of public masses at St. Pius. There have been a number of directives that we have reviewed from the bishop as well as from state health authorities in thinking how we move forward. There are many things that we have to plan for. We have heard from many of you that you wish to be back at church now. We've also heard from many of you that you have significant concerns about the safety of returning to church. and would prefer not to return because of concerns about your own health or the health and safety of your family and loved ones. That means for us, we have to find ways that we can meet the spiritual needs of our entire faith community, those who wish to be in church as well as those who wish to be with us, but physically separate. In our planning, there is one overarching and paramount objective for us, and that is to be safe. Our staff is our single most valuable resource. If any of them would become exposed or infected, we would not be able to have masses or funerals or weddings or any other St. Pius activities for at least 2 weeks. If any of our parishioners should become infected or exposed while at church, it would trigger a contact tracing cascade organized by public health officials, where they would contact us and ask to know who had been at the Mass so that they may contact them. And of course, we certainly do not want any of our parishioners to feel uncomfortable or unsafe, and certainly not have anyone become ill because of attending a service at St. Pius. So, as you might imagine, there's lots of planning to be done. We've had to physically measure off the church at 6-foot intervals to understand how many people we can serve. We've had to think about everything from how people enter the church and leave the church, how we do communion, how we carefully and safely prepare the communion hosts before Mass, during Mass, and after Mass, whether we have collections, how we hand out bulletins, and how we move people in a one-way fashion through the church during services to maintain physical distancing. We have to also think about whether we have enough supplies of disinfectants and cleaning solutions, hand sanitizers, masks, gloves, protective equipment. We have to figure out how long it would take to clean the church after Mass and thoroughly disinfect it, since this will determine how frequently we can have Masses on a weekend especially. It's also important to recognize that our Masses depend on the work of a small but dedicated staff and a number of volunteers. All of these procedures have to be rewritten, and we have to train our Eucharistic ministers and hospitality ministers in these new procedures. And we have to talk with our volunteers. Many of them are older and would be considered at high risk, and we've not yet had a chance to talk with them to understand how comfortable they might feel in coming back to a public Mass at St. Pius and potentially confronting the risk of COVID-19 infection. We certainly are going to be mindful of their preferences in this regard, and it may be that we need to recruit larger numbers of people who can help us with the Mass each weekend. We hope that you will understand how much work goes into this planning and will be patient with us as we try to develop these procedures that are intended to create a safe and welcoming environment in a new world, one where we have to coexist with the COVID-19 virus. So let's talk a little bit about what it will be like when you come back to Mass. It certainly will not be Mass as we knew it before. First, before coming to church, if you are sick or a member of your family is sick, do not come to church. If you are older and have chronic conditions like diabetes or heart disease or lung disease, think about not coming to church. If you're taking potent medicines called immunosuppressives that are used to treat cancer or certain gastrointestinal diseases or inflammatory arthritis, you should also think about not coming to church and celebrating with us instead in our virtual Mass. When you arrive at church, the doors will be open and you will be asked to move to a designated seat as quickly as possible. You'll find seats marked in green. You'll also notice that there are large areas of the church that are roped off with yellow tape, and these are places where you should not sit. Of course, families from the same household will be able to sit together, but this may mean that it will reduce the number of places that are available for others. When the time comes for communion, our hospitality ministers will direct you to a communion station by row and by section. When you approach the priest or Eucharistic minister, please hold the palm of your hand widely open so that the priest or Eucharistic minister can drop, without contacting you, a communion wafer into your hand. We ask you to step aside and then remove your mask to consume the body of Christ, and replace your mask before proceeding back to your pew. At this point, I can also remind you that everyone who comes to Mass will be required to have a mask. Now, when Mass is over, we will not have a headlong dash to the door. Instead, we will have a more orderly recessional. Again, our hospitality ministers will be asked to dismiss by row and by section. And we ask that you maintain a direct and orderly pathway out of the church. Please, as much as you would like to greet your friends, move steadily through the aisleways, past the entryway and outside the church, and don't congregate in the doors that might block the path for others and create a closer environment that we would like to avoid. These are just some of the changes that will occur in the early phases. The regulations and what we know about this virus are changing. And already in the week that we have been working on the planning, there have been 3 major changes and recommendations from the bishop, the state of Minnesota, and from others. So we hope that you'll be patient with us as we try to create, again, a comfortable and a safe environment that takes advantage of all that we know about the virus, as well as working hard to make sure that we can celebrate our faith together in the safest way. We appreciate your patience and your understanding. We know that the good and faithful people of St. Pius will be ready to help us as necessary, because the church is us. And certainly if there's anything that you would like to share with us, please let our staff know. If there are ideas you have about things that we could do better, if there are concerns or worries that you have that we have not worked to make you sufficiently safe, please let us know those too. We are grateful for your patience and understanding. In the love of Christ, as a faith community, we will grow through this together. Thank you.